Good evening, everyone. My name is Abhishek Jain, and I'm pleased to invite you all to the KYO series or the Know Your Options post 12th grade series by Planty. In this session, we would be covering a Bachelor of Dental Surgery or a BDS degree. Today, we are very fortunate to have with us Dr. Sonal Bhatia, a graduate of the 2019 batch of the Maulana Azad Institute of Dental Sciences with a BDS degree. She has also been a junior resident at AIIMS New Delhi and at Deep Chand Bandhu Hospital. She is currently pursuing her Master of Dental Surgery or her MDS degree in Public Health Dentistry, also from the Maulana Azad Institute of Dental Sciences. In today's session, Dr. Sonal will be speaking in detail on pursuing a BDS degree, what it entails, and the various opportunities and career options that it opens up upon completion. I would now like to hand it over to Sonal to begin the session.
Thank you so much, Abhishek, for having me here. He has already introduced me. So, I am Dr. Sonal Bhatia. I have done my Bachelor of Dental Surgery degree from Maulana Azad Institute of Dental Sciences. And as soon as I finished my internship, I went on to do junior residency from AIIMS New Delhi and Deepchand Bandhu Hospital in Delhi. So I wanted to talk about dental surgery because there are a lot of myths, and it is a very ill-famed branch of medicine. Usually, people do not like to opt for dental surgery. It's not a very popular opinion to opt for it. So I would like to talk about it, and I would like to talk about my experience in my institute as well. So, to begin with, I would like to share a presentation. So, uh, Firstly, I would like to talk about who should opt for this course. I always believed if you want to enter the field of healthcare or the field of medicine or the field of dentistry, first and foremost, you should be very patient centric person. You should possess the quality of empathy because it's a very giving branch. You have to be very patient. You have to deal with a lot of patients. So you should have that quality. And if you want to serve the humanity, you want to treat people, free people from their ailments, I think you should opt for this branch. When I first entered in my institute, my dean, my professor, he gave us an orientation lecture, and I still remember his line. He told us that dentistry is not only science, it is a mixture of science and art. So, I will explain on this later. I think if you are inclined towards science, but you have a very artistic and creative mind, you should definitely opt for dentistry because there is a lot of creativity, your craftsmanship that will show in your work during your profession. So, third thing that I would like to point out here is, as you can see in this picture, this is a dentist and this is a dental assistant. They're working on a patient, and as you can see, he is using a microscope on his patients. So, one more quality that you should possess, like if you are a perfectionist and you give attention to even the minutest of the details, then this profession is for you because we have to be very meticulous with our work because we're working on very tiny structures, very small structures, and very microscopic structures within the tooth. So we have to treat them. We have to basically perform surgery on that area. So your hand should be very stable. You should have very good neuromuscular coordination. You should have those skills. So that's why I said that art is also a very important skill that one should possess if he or she wants to take up this profession. So let's move on to what were my motivations for actually pursuing this. To be honest, this was not my first choice. I did not want to even be a doctor, let alone be a dentist. I did not, I wanted to steer myself away from the field of healthcare. I did not have the passion for it, but I wanted to actually pursue pure sciences. So I wanted to be a researcher, I wanted to be a scientist, but then I got a really good rank in my NEET exam, which is the entrance test for this field. So I thought that maybe I can pursue it. Also, I wanted to be a psychologist, and I was always very intrigued by the human behavior. So I thought that treating patients will be a very interesting expedition. It would be a very interesting adventure for me because I really like studying human behavior and minute details. So that's why I picked it up. Also, one of the biggest motivating factor for me to pick up this branch was because I got admitted into this institution, Maulana Azad Institute of Dental Sciences. So I wanted to talk about this place first and foremost. So, a lot of people might know that this is the premier and leading dental college in the entire country. It has been ranked number one continuously for a lot of years. It is the go to institution if you want to learn dentistry, and it is placed in right in the heart of the city where there are a lot of there's a lot of patient outflow. So you can like get a lot of clinical experience, amazing faculty members. So that was one of my motivations. I picked up this field. First, I would like, if, for example, if you are a 12th pass out, you are or even if you are studying in 10th right now, you would be very confused as to what you have taken up, let's say, medical stream, like the PCB section, physics, chemistry, biology section, and you might be very confused. What should I do with my career? There are a lot of options ahead of you. You can either do MBBS, you can do BDS, you can become a physiotherapist, you can go into Ayurveda, pharmacology. You have these medical fields. Also, you have a lot of sciences field as well. BSc, you can even science graduate people can also do BCom. But I would like to explain a very vital difference between these two. BSc is a scientific degree, it's an academic degree, while MBBS and BDS, they are professional degrees. So, what is a professional degree? Right from the start, we are trained to trained for a job. We are always trained to do professional work. We are not academicians. Like we are obviously reading the theory and academic part of it as well, but we are trained. For us, that field work was our clinics. We were exposed to clinics from the get go. So uh, one of the major differences between a scientific degree, which is BSc, and your MBBS and BDS, is that after BSc you have a lot of options. Like you can opt out for, let's say, MBA. You can basically, there's a world of opportunities for you. You can change your career as well. But when you are opting for a professional degree, you have to be very careful. You have to be sure that yes, I want to be a dentist, yes, I want to be a doctor. Only then you should opt for this, because you will be a professional, you will be a doctor, you will be a dentist, you will come with that tag after that. You cannot like, obviously you can change your profession anytime in your life, but that will be your tag. You are trained for that profession now. So I would advise all of the people who are currently thinking about it, so you should be prepared for this aspect. And other thing that you must be knowing is about the NEET exam, which is the National Eligibility and Entrance Test. uh, it is an extremely competitive exam. Almost all of the people who have taken a PCB, they prepare for this exam and they give this exam. Last year itself, there were 15 lakh plus applicants around the country. Because it's such an extremely competitive space, only top 5,000 or maximum top 10,000 ranks manage to get good medical colleges or good dental colleges. uh, what they have done right now is NEET. Before, when I gave my NEET in 2014, AIMS used to conduct a separate exam. All the other central universities, such as Jamia Millia Islamia, Aligarh Muslim University, they used to conduct separate exams. Now, NEET has become an umbrella exam under which all of the people can like if you want to apply for MBBS, BDS, physiotherapy, you have to give this exam, and all of the dental colleges, even the state colleges, state medical colleges are now underneath. So there are no separate exam. There is only one shot if you want to do this, which has its own advantages and disadvantages. So this has been done last year itself in 2020. Now AIMS is also under this NEET exam. So the pattern for this exam is that uh, there is these syllabuses: physics, chemistry, biology. In biology, there are two subjects: botany and zoology. So basically, it becomes four subjects: physics, chemistry, botany, and zoology, and four are given equal weightage in the exam. So total marks for the exam is 720 marks, and four subjects are given equal weightage. So you should be prepared in each of them. And the last year, if you want to do BDS from Maulana Azad, the cutoff was around 600. So there are certain top medical and dental colleges. I'll name a few of them. There in Delhi, I'm talking about Delhi. There is AIMS, there is Maulana Azad Medical College, there is University College of Medical Sciences (UCMS). Maulana Azad Institute of Dental Sciences is a part of MAMC, Maulana Azad Medical College. We call it MAMC in Delhi. So these are the top ranking colleges, and they are government colleges. Their fees are very low, extremely low. So that's why they're very coveted colleges. So I started my BDS in 2014. My my tuition fee for 1 year was 1,700. That's it. So basically, I think I paid around 5,000, 6,000 rupees for my entire BDS program, which is of 5 years. And I got my money back in my internship process only, because we get a stipend in government colleges. So that stipend is around 23,000 per month. So basically, your BDS program is of 5 years. First 4 years, you are studying, you are learning the theory, and in the fifth year, you have a mandatory internship, a rotary internship in the same college. So, because Maulana Azad is such a coveted college, the cutoff was around 600 out of a total 720. So, that is a very tough cutoff, and those marks are very difficult to achieve. So, let's talk about the BDS course in itself, the 5 year BDS course, what entails in it, what are the opportunities and skills you'll get to learn. So, first 4 years, you're learning your theory. In the first 3 years, we're learning our medical basic sciences subjects along with our MBBS counterparts, because I was studying in MAMC, Maulana Azad Medical College. So, we used to study with the MBBS counterparts. We used to study the same subjects. For example, in first year, we used to study anatomy, physiology, biochemistry. Second year, pathology, microbiology, pharmacology. In third year, we study general medicine, general surgery. So we are studying the same subjects as the MBBS counterparts, but there's a difference. In first year, we are also introduced to our dental subjects. So in first year, there's a subject called as dental anatomy and dental histology. So I remember I came first day in my college in my BDS program, and I was introduced to this. So this is a wax block. As you can see, the person who is holding that white thing, it's a wax block. So I was given this wax block that we have to do a carving. So this is dental anatomy. So basically, what we are doing here is that we are learning the anatomy of the tooth, and we have to replicate and we have to carve out a tooth. The reason we are doing it, because we want to create that artistic skill that I talked about earlier. So we had to carve out the tooth which looks like this. I was very interested. All my I think most of my batchmates were very dumbfounded by this process. They did not really like it, because people are not really inclined towards craftsy things. I really liked it, and certainly, if you're inclined towards these things, you will find it very interesting. Also, we were exposed to this. Okay, now as you can see, this is a prosthodontics lab. As you can see, all of these are dentists, so they are working on something. As you can see, this is called as a complete denture. They're making a complete denture. So denture is a replacement of the tooth of the entire. Like old people often need these dentures. So we have to make all of these dentures from the scratch to the finish. We have to place the tooth accordingly. There are a lot of things that you have to be there to be. You should know, like example, you should know the mechanics of tooth movement. You should know how your jaws and muscles. So one thing that I always realized during my 4 years of course is that I'm not only studying biology, I'm also studying physics and chemistry. I'll tell you how I'm studying physics. Physics is all about mechanics. So dentistry is a lot about mechanics of your tooth movement, how jaw is being calibrated, and also chemistry, because as you can see, use a lot of, like you can see this pink stuff. This is an acrylic resin. We actually use a lot of dental materials. So you should know the chemistry of them. How are they? What are the ratios of mixing these resins? You must have seen your dentist mixing when he's doing a filling. They mix a cement kind of substance to put in your teeth. So you should know the chemistry behind each of these dental materials. It's it's a very wholesome, a holistic subject. You should know about all of these things. So one particular thing I liked about dentistry was that from our third year itself, we were introduced to the clinics. Like usually what happens in a medical college is that you study for 4 years, and in your internship you are introduced to the clinics. But in dentistry, you are introduced from the clinics from third year itself. You are given a patient that you have to treat this patient. This is your patient. So we had to be prepared for that. So in second year, we used to work on this thing, the scary looking thing you can see on the top left corner. This is a phantom head. As you can see, it is a patient simulation actually, because we cannot work on a patient from the get go, or we'll just harm the patient instead of treating him. So we used to perform our dental surgeries on this. It was called a typhodont, and this is a phantom head. And we do our surgical procedures here, and then from third year onwards, we are exposed to the patients. So there are a lot of opportunities and skills you will learn. As I talked about earlier, you are already gaining knowledge about basic medical subjects, your general medicine, your general surgery, how to do sutures, all of those. You are getting how to diagnose a patient, how to what kind of medicines you should give. Apart from those basic medical subjects, you would be also trained in these 9 fields of dentistry. These are the 9 specialities of dentistry which I've laid down for you. So we start to learn about these specialties in our fourth year. Now, first one, I would like to talk about these specialties. First is oral medicine and radiology. So, as you can know from the name, in oral medicine, we are diagnosing and treating a patient. And in radiology is basically about x rays. We're doing x rays of our patients, and then we are basically what happens in dentistry. For each and every patient, you have to do an x ray. It is a very vital part. So, we study about x rays and how to take an x ray and how to interpret them. Second is oral and maxillofacial surgeon. I would like to address a big misconception about the field of dentistry here, that dentists only work on this area, the the teeth. But that is not true. We are doctors of oral and maxillofacial area. So oral means your oral cavity, maxilla means your upper jaw, and facial means your entire face. So we are doctors of this area. So any injury, any abnormality of this area, a dentist would treat it. So, an oral and maxillofacial surgeon is just a specialized surgeon who's performing surgeries in this area. So, for example, you get a case of oral cancer. It has been referred to a general surgeon. So, a general surgeon will refer it to a specialist who is an oral and maxillofacial surgeon, and he will surgically take out that oral cancer, that malignancy, that tumor from the mouth. So, one a thing I would like to talk about oral and maxillofacial surgery is that this is very up and coming field, because there are a lot of debilitating conditions in this area. You have your oral cancer, which is the most prevalent cancer in India in males, because tobacco habit is very common in India. And you also treat fractures, trauma cases. If you have any fracture to the jaw, an oral and maxillofacial surgeon will treat it. So it is a very up and coming field. Then we actually do our postings in OS. We call it OS, oral surgery, in our third year, final year, and internship as well. Then we come to prosthodontist. So prosthetic means something that you are replacing, like a prosthetic. And dentist means dental. So basically, your fake teeth, like dentures, caps, bridges, a prosthodontist would do it. So we have been introduced to this from our first year of BDS course. In first year, we are introduced to the prosthodontic lab that I showed you earlier. This is the prosthodontic lab. So we are trained in this field as well. Then we come on to conservative dentist and endodontist. This is the bread and butter of dentistry, to be honest, because this person would do your fillings, which we call as restorations, and endodontist would do your RCTs, root canal treatments. So this, as you know, these are the most prevalent treatments that prevalent diseases that people come with, and we treat them in this manner. Then we come to orthodontist. Ortho means straight, dentist means dental. So basically, straightening of your teeth. Nowadays, it's very famous because everybody wants to get braces, everybody wants to get their teeth straightened. Cosmetic dentistry is very up and coming, and you must have seen there are a lot of dental clinics which offer cosmetic dentistry services. Often with the like you, there is a dental clinic right down in my neighborhood. There's a dermatologist who is the doctor of the skin, and then you have a cosmetic dentist. So they're working side by side. So this is a really nice field. Then we go to pedodontist. Pedo means child. So basically, this is a dentist who specializes in treating the child. Periodontist. Perio means your gums and your related tooth related structures supporting them. So all your diseases like swollen gums, bleeding gums, that would be treated by a periodontist. Then you have a public health dentist. So, as you know, public health means the general welfare of public. Basically, we used to call it community dentistry. It's all about the community. So, we would go to remote areas to treat certain patients who do not have access to healthcare services, and in general, we are looking at very preventive aspects of dentistry. Preventive, as in how to prevent all of these major diseases like cavities, you have your gum problems. So, a public health dentist is focused on the preventive and the community aspect of it. Then we come to an oral pathologist. And so you might know a pathologist is someone who looks down in a microscope and he is looking at your tissue specimens. So an oral pathologist would do the same, but the specimen is from your oral cavity, from your oral and maxillofacial area, and they would diagnose the disease based on the specimen they are studying. So forensic odontology is now a part of oral pathology. I would like to talk about this because it is a very uncharted field of dentistry and it is very interesting. I'll talk about it later. So I would like to address what should be your career expectations after you complete the course. One career expectation that comes in everybody's mind is private practice, opening up their own dental clinic. Like you would assume, if a person has done their BDS, they will open up their own dental clinic. Now, the advantages of this career aspect is that you are independent, you are your own boss, you are doing it your way, you are treating patients, you have flexible hours. Like you can open up your clinic from 9 to 1, you can open up your clinic from 5 to 7. Uh, it's your clinic. So definitely it's a very lucrative career opportunity, but obviously there are some pitfalls to it as well. Like you need a lot of monetary capital to invest in a clinic. To open up a clinic, it's very expensive to open, especially in a city like Delhi. It's very difficult. So, so certain people After BDS, they start looking for jobs. Like they want jobs. Like if you are doing a course, for example, if you're doing BSc, then you're doing MBA, so you would be expected that okay, now I'll get a job, I'll get my placement. There's no such thing as placement in medical degrees. You do not get placed. It's your, you have to find your own niche, you have to find your own jobs. So it's a little disheartening, to be honest. I must say that in India, the government jobs for dentists are very sparse, very sparse. They're not very many jobs, but still, if obviously if you are very passionate about your field, even though there are less jobs, you can get certain jobs. So government jobs, like junior residency, then you have certain PSCs. So PSC means public service commissions. For example, you have your UPSC, you must have heard. So it's a public service commission exam. So you can become a dental officer serving that particular state. For example, Haryana PSC, HPSC, you would have to serve in Haryana as a dental officer. Then you have your UPSC, that's for your entire country. Then you have your Army Dental Course. So if you are that kind of person, you want to serve your nation, you want to get into Army, Navy, or Air Force. It's very like people are surprised by this, but there are a lot of dental jobs in these places as well, even in railways. So you can get appointed as a short term dental officer, or a long term or a permanent dental officer in Army, Navy, Air Force, and railways. So people who want to serve the nation, it's a very good job prospect for them. Then you have the prospect of, obviously you can do your MDS after your BDS, and then you can be a specialist. Like the nine specialities I talked about, you can do your MDS in any of those fields, and then you can become a specialist in those branch in that branch, and then you can become a consultant for a clinic. So that is one career opportunity you can go for. Then there is an opportunity, you can become an academician, professor, or a lecturer. Obviously, you are studying this field, you are studying the theory part of it, so you can go into that. You can become a professor in a dental college and teach people. Even nowadays, like you can even teach in a coaching institute. There are a lot of coaching institutes. You can even teach people who are studying for your NEET UG exams as well as NEET PG exams. Like that is very it's a career that is opted by many. Then you can become a researcher, because science is a integral part of this field. You can become a researcher, you can like create new dental materials, you can do a lot of, like you can create a new treatment options, you can, there are a lot of options in research. So one thing a lot of people don't know, that you can even work in the corporate sector after doing your BDS. Multinational corporations are now hiring MBBS and BDS graduates, because they have a lot of projects related to healthcare, especially after COVID-19 pandemic happened. So people realized in the corporate section, they realized that health is very important, and then they started picking up these projects in the healthcare sector. So now they need experts in these sectors. So now they are hiring your doctors in the corporate sectors as well. So you can also become an hospital administrator. So what is an hospital administrator? There's a degree called as MHA, Masters in Hospital Administration. You can do that after your BDS. Uh, I remember I went to a particular, a very famous hospital in Delhi, and there was a hospital administrator there who basically manages the entire hospital. And he told me that, do you know that we actually, BDS graduates are preferred over MBBS graduates for hospital administration job, because they know how to manage clinic. They have been trained to manage clinic from a very young age. Like from our second third year, we are trained to manage, we are trained to how to treat patients, what are the documentation systems, how you have to allot your patients according to the workforce you have. We have been trained in that. So it is a very good career option. You can do your MHA after BDS. Then there are other jobs as well, special care dentistry. You have your geriatric dentistry. So geriatric dentistry basically caters to the old population. And then you have your cosmetic dentistry, which I talked about earlier. It's very famous nowadays. Aesthetic dentist, they call it. So you can do a diploma in aesthetic dentistry or cosmetic dentistry after your BPS, and you can practice as a cosmetic dentist. Then you have your masters in public health, which is MPH. So, as I told you, public health is a very big field. People who are working in WHO, for example, World Health Organization, they are all public health professionals because they're dealing with masses, they're dealing with the community. So you can do your MPH, and there are a lot of MPH options. You can do it from India. There is a Tata Institute in. It's very famous. Then you can do it from your PGI Chandigarh, PGI MER Chandigarh. But you can even do your MPH from abroad. A lot of people who graduate after doing their BDS, they opt to go to Canada or Australia to do their MPH because it's very popular there and there are a lot of job opportunities there. Then we come on to forensic odontologists that I wanted to talk about. So interestingly, I'm doing a course in forensic odontology right now. I have gained a lot of insight into this field of dentistry, which I did not know. Basically, forensic means you are finding evidence, as you know, forensic experts. And odontologist, odonto means a dentist. So basically, you are going to a crime scene and then you're collecting evidence based on this area because tooth are very destructible in nature. So even after a person dies, teeth they live on. So you can gain a lot of evidence, DNA samples, etc. You would be very surprised to know that one of the biggest cases in India was solved by a forensic odontologist. That is the Nirbhaya case. So what happened with Nirbhaya was because her body was totally mutilated, there was no DNA sample left in her body, and they had to find who was the perpetrator. So they used bite marks. So there were a lot of several bite marks on a body that the perpetrators left on a body. So then a forensic odontologist came on that scene. They took up the impressions of the bite marks, and from there they made a possible list of the perpetrators, and that's how they were caught. Also, there's a very famous case. There was a very notorious serial killer in USA. I don't know if you guys have heard about it. He's called as Ted Bundy. So the case of Ted Bundy was that he killed 60 plus women, and he was in the end there was no evidence against him. There were a lot of trials going on. Then in the end they had to call a forensic odontologist. So there were remnants of teeth left in the corpses he had the women he had killed. They picked up those teeth, they did a DNA profiling, and then Ted Bundy was identified as the killer. So it's a very up and coming field. The reason I'm talking so much about forensic odontology is that there are very few institutes in India. There's only one institute in Gujarat who specializes in forensic odontology, and there is one in Bristol in UK. There is one in Wales. Very few. So I think there is a lot of future in this branch, and if you are pursuing BDS, you can look at this as a great career option if you are interested in this kind of thing. Now I will be talking about certain common myths. And one such common myth is that dentists are not doctors. Like a lot of people say that dentist, or you are a dentist, you are not a doctor, which is very untrue. As I had mentioned earlier, a dentist is also trained in all of the medical subjects, same as a physician, same as a medical physician. The thing is that MBBS and BDS, they are two different streams, but they're very analogous to each other. They have very different origins. BDS came from the need to basically, it was a surgical field. It was a field of barbers. It actually originated from barbers who wanted, cosmetic fixing of their teeth, who wanted to get their tooth extracted. So that's how BDS originated, and obviously MBBS originated from allopathy. But now they are working side by side as two analogous branches who are treating patients, diagnosing, and basically doing the same. Uh, Basically, we are learn and we are trained in the same field and the same subjects. So that is very untrue. And second myth that I would like to address is that uh, dentists, like after dentistry, you can only do private practice. You can only open up your dental clinic. There are no jobs after BDS. Like what else you, and even when you're doing your private practice, nobody wants to come to you because you're like charging a very exorbitant fee. Because it's always believed that dentists are very money minded, greedy people who are charging like 10,000 rupees for a procedure. I would like to address this myth because it is not true. The thing is that our procedures are very costly. They require a lot of skills, a lot of training, and the dental materials are very expensive. So that's why a dentist would charge that amount of fee. And regarding that, there are no other options uh, uh, except your dental clinics. I have talked about a lot of career opportunities you can do after your BDS. That is not the only like thing you can go after your BDS. So I would like to talk about a certain, like I want to give you guys, give the audience members a little tips regarding uh, if you want to get admission in BDS, or if you want to get your BDS degree from Maulana Azad, I would like to give you certain tips. In your 10th, 11th, 12th, study your physics, chemistry, biology really well. Study your standard textbooks, study your NCRT textbooks, learn them by heart. You don't have to like take up a coaching institute. You don't need that. If you are thorough with your books, if you are thorough with your NCRT books, you will crack your NEET, you will get a good college. And also, I would like to give certain tips to people who are pursuing BDS or want to pursue BDS, because they're disheartened by the state of this branch in India, because they think that we get less respect. I would like to say that respect is something which is earned. If you are passionate about the thing you're doing, you would definitely succeed. There are limitless opportunities. Nothing is limited. If you want, you can carve your own niche, you can carve your own path. So don't be afraid. If you want to do something, do it. If you want to be a dental surgeon, you should definitely opt for it. And best of luck for those who are appearing for NEET. I think 1st August is the date for that. Best of luck to all the aspirants. I hope you get good marks.
Thanks a lot for that, Sonal. I think that was a very, very detailed presentation, and I think you've covered everything, starting from why you chose this degree, and also why somebody else should actually do this degree, and also what they could do after they've taken it. So, thanks a lot for that.
Thank
Moving
you.
on to the Q&A session, I think I have very, very few questions after that very detailed presentation. So, my first question is actually to do a little bit with the fact that the entrance, as I understand it, there's a competitive exam, and it's a very competitive process in India to actually write that exam and then also get a college or a seat through that. So, when do you think is the right time for a student to actually make up their mind that, okay, a BDS is what I wish to do after I'm done with my schooling, and maybe right now is the right time that I start preparing for the relevant competitive exams?
So I think before making any decision, you should explore that field. You should go to a dental professional. Like if you have a dental clinic nearby, I think people who are aspiring to be a dentist, they should go to that dentist and see their own personal, what troubles they had faced and what they are doing, what kind of treatment they are offering. So from that you can like learn a lot about this field. They should not go in a certain field blindly. A lot of people take BDS blindly. They are not interested in it, and then they end up losing interest, and then they end up regretting it. So I would suggest that you should learn about the field. You should directly go to the professionals and ask them. Also, the very important point to keep in mind is that, which I had mentioned earlier, that it is a professional field and you will be a dentist after this. And if you are passionate about treating people, then definitely go for this job. There is It's a very giving and very fruitful branch. You will like earn a lot of when you treat a patient, you get a lot of gratitude from that patient. That feeling is uh, amazing. So if you want to do that, if you are really passionate about it, you should start considering it from 10th standard onwards. Like you should, and you should explore that field.
Definitely, I think that makes a lot of sense. I think moving to my second question, I think this is something you had spoken about in the initial parts of your presentation, and this is actually more of a comparison between, let's say, a BDS and an MBBS degree in India. Because if I understand correctly, there is a common entrance that a student needs to write. So a lot of times, there's a lot of students that you see in their 12th that come up with this idea that they'll just write the NEET, they'll see the rank that they get, and then probably just take what they get. Do you think that that is a good approach, or do you think it's a healthier approach to be very clear that, okay, I would want to go into a BDS or an MBBS? Or how do you think somebody should approach that?
See, definitely. So basically, what happens in India is that certain top ranks, they will select MBBS. There are certain top rankers who will take BDS on purpose, mostly because their parents are dentists, because they think that they have their own dental clinic. That's why they opt for it. But rest of the people who did not get a MBBS seat, they blindly take BDS because they think, okay, at least I'll be a doctor. I'll get I'll be a doctor. This. But this approach is not good. You should not, like I told you, that you should not get into this blindly. And see, I always tell people that college does not matter. Your branch matters. So what people do that. They take, like, for example, they're getting admission into Maulana Azad Institute of Dental Sciences. So top rankers get into this college. Now they think, because it's such an esteemed institution, it's okay. I'll take BDS. At least I'm doing it from a good college, such a famous college. So I will be guaranteed a job after this. You should not do that. If you are not interested in the field and then you are taking up the course because of the college, this is wrong, because you will be stuck with that field your entire life. You will be a dentist your entire life. College is just a name. I agree that college adds a lot to your resume. It adds a lot to your skills as well. But just for the sake of studying in Maulana Azad, taking a BDS, even though you do have like no interest in it, that is very wrong move. You won't be able to be successful in this field. You should be passionate about it. You should explore it first.
Look, definitely. I completely agree with you on this point because I think it is really important that we make an informed decision about what we are doing rather than just going into the first college that we get. That definitely makes a lot of sense. And I think that brings me to the end of my Q&A session for today. So with that, I think I also come to the end of the session. So I would just like to take this opportunity, Sonal, to thank you on behalf of Team Plant for taking the time out for this lovely session and that amazing presentation. Trust me when I say this is going to be really, really useful for students that are going to watch this in the future and then accordingly plan out their careers. So thanks a lot for joining us today.
I'm very glad. Thank you for having me here, Abhishek. Thank you so much.
Thank you. All right. I think I've